Hi, I'm Mary Lee. I'm the President and CEO of Health Association Nova Scotia and also President and CEO of our subsidiary company, Agility. Health Association Nova Scotia is a not-for-profit, member-based organization. We've been around for over 60 years and we play an integral role in organizations that work within healthcare. So that could be a hospital, a long-term care facility, home care, various foundations. So there's 4 core areas that we focus on. So we have what we call them all shared services. So it's a service that we would provide to a large group of members. Organizations will join hands because they want to participate in our benefits program. So that could be our health or dental, long-term disability, other types of insurances that they need for healthcare. Another area that we have a shared service focus on is labor relations and compensation analysis. So we do bargaining for the employers for the province in healthcare in Nova Scotia. So I have a team of lawyers, paralegals, and assistants that do the work around the province for labor relations. The third area that we do is biomedical engineering. So I have about 40 staff around the province that work in various hospitals and institutions, and they're out there fixing equipment. So it could be anything as simple as a wheelchair to something as sophisticated as an anesthetic gas machine. So we provide those services around the province as well. And the fourth area that we have a shared service in is around our policy support. So policy advocacy work, we take on system-wide province issues and work with providers and facilities to create solutions to those problems. So we work with all of our members, and our members are organizations like the Nova Scotia Health Authority, the IWK, Women and Children's Health, plus all the long-term care and home care basically in the province. So we basically touch everyone who goes through the healthcare system in any way, shape, or form. Health Association Nova Scotia is a not-for-profit. So what that means is we provide services at cost, basically. So we're not out there trying to make money off healthcare and social systems within the province. It's all for the benefit of Nova Scotians. So it's not about making a profit or making money. It's about, here's our healthcare system, and we know we have lots of challenges in our healthcare system. So how can we be that catalyst to work with all these people we touch to affect change in a positive way that will have a positive outcome for Nova Scotians? My journey down this path of embracing technology probably was really sparked, I'm going to say probably a year and a half or 2 ago, when I went to an international conference. And there was one of the speakers there who talked about actually about a future makers group and about embracing youth who are so exposed to technology to help guide and shape how organizations work, and really how we avoided it because we don't understand it. We didn't grow up with it. So I started being exposed to different speakers and talking about different innovations and how technology can be used. That's actually what this is all about, right? It's about harnessing innovation and disruptive technology to shape HANS into the future. So one of our strategic directions is driving innovation. And I have a strategic direction. I need to live and breathe that. This isn't just an exercise on paper. So HANS, as I talked about, we have these 4 core services. A lot of the services that we do are very transactionally based. So I have people upstairs that enter things on a computer. Somebody calls and pick up a phone, they answer the question, they enter the data, they send the data to someone else. So I think to truly look at our business model, I don't think it's sustainable for the future. I think we need to embrace disruptive technology. We need to embrace artificial intelligence. We need to embrace machine learning, predictive analysis, deep learning. We need to get our hands around that and say, how is that technology, how do I use that technology to deliver my services to the people who need them and deliver them in a cost-effective way, at an innovative way, in an efficient way, so that people get the best resources that they can get with the best value behind that. So I want to really tap into that innovativeness, and I want to talk about disruptive innovation, technology, and how's that going to impact the services that we provide at Health Association. And how do I attract young individuals and young adults to come into my organization? And I want you to tell me, what do I need to do to make this organization the place where you want to come and work? What do I need to do to transform these services that I provide that are keeping up to date and current with technology? And you will be the ones affecting change. So help me affect that change now and set this organization up. So I really want your thoughts, your unbridled opinions, your untethered conversations around what do I need to do to make this organization sustainable in the future, and how do we use technology and disruptive innovation for the positive impact on the social system that we have here in Nova Scotia and even Canada. We're far-reaching.